Hi, I'm Sydney James.
Hi everyone, my name is Mallory Hogue and I am a sophomore in Speech, Language, and Hearing Sciences.
Hi there, my name is Carolyn, and today I'm going to be talking about the Pierre-Robin sequence. The Pierre-Robin sequence is present in 1 out of every 8,500 births. It is something that develops in a baby while they are still in utero. There are several symptoms or problems associated with the Pierre-Robin sequence that cause each other in a sort of domino effect. That's why it's called a sequence. The first and most prominent of these is that a baby with Pierre-Robin sequence will have a small lower jaw. They'll have airway obstructions, and they will have glossoptosis, which is a problem with their tongue, where it'll be further back in their mouth than it is supposed to be, and usually smaller than it's supposed to be. This can contribute to the airway obstruction and make it hard for them to be eating. That can also sometimes cause cleft palate, although cleft palate is not super common for babies with the Pierre-Robin sequence. It is not unheard of, and it is even more likely if the baby has isolated Pierre-Robin sequence.
Many people can play a role in the treatment of children with Pierre-Robin sequence. Some of these people can include pediatric plastic surgeons, pediatric ear, nose, and throat specialists, an orthodontist, an audiologist, and a speech-language pathologist. A pediatric plastic surgeon would be able to fix a cleft palate and move the lower jaw forward, which would help with the child's breathing and eating. In extreme cases of this disorder, the child's tongue may be completely blocking their airway, in which case they would require a tracheotomy or gastrostomy tube to help their eating and their breathing. These children could also benefit from orthodontic services since their teeth can be very overcrowded due to the small size of their lower jaw. A speech-language pathologist may be able to provide speech therapy to these children to help these children say sounds that require the use of their tongue, which they have difficulty with since their tongue is far back in their mouth. A child may also benefit from the services of an audiologist since they may experience hearing loss due to a high rate of ear infections associated with this disorder. Intervention of Pierre-Robin sequence should begin at birth. The baby will have trouble breathing and eating, and if immediate action is not taken, then they could become malnourished or suffocate. From there, their individual symptoms should be evaluated and treated as necessary.
There are 3 organizations that can really help support families that have children with Pierre-Robin sequence, and they are FACES National Craniofacial Association, Children's Craniofacial Association, and Cleft Lip and Palate Association. And all 3 of them really help the families with mental and financial support, and they also bring a lot of public awareness about these conditions that people don't know about. An interesting fact I learned about Pierre-Robin sequence while researching is that males and females are both equally likely to develop it, but twins have a higher incidence rate of developing it.
One of the most interesting things I learned while studying the Pierre-Robin sequence was that it can be isolated or it can come with other problems as well. There are some other things like Stickler syndrome that commonly accompany it, but it can also be isolated.
The most important fact that I learned about Pierre-Robin sequence is that if the condition is isolated, then the effects are not lifelong. The jaw can catch up and grow to normal size, and the child can have a normal profile by the time they start school. This was surprising to me because after looking at the physical effects of this disorder, it is not something that you would expect to be able to fix itself when in reality it can.
This was a very interesting problem to research for me because I personally did not know anything about the Pierre-Robin sequence beforehand. Since I personally am not going into a medical field, I will probably not be coming into contact with people who have Pierre-Robin sequence other than in the workplace in my future. I could end up working with someone who had it and received treatments.
Having a patient with Pierre-Robin sequence on my caseload would definitely impact my career as a speech-language pathologist. Providing successful therapy to someone with a cleft palate, as well as glossoptosis, would definitely be a challenge and a great learning opportunity.
How Pierre-Robin sequence is going to affect patients that I work with is I will be working with children that have autism, special needs, and disabilities. So I could potentially have a patient that has it